Listen up, folks. We need to take metabolic health more serious. Dr. K here, IC physician. I heard a podcast recently that mentioned all the disease states that were impacted by poor metabolic health. And just to be clear, when I say metabolic health, this is your ability to generate energy. So people with poor metabolic health tend to be obese. They tend to have lipid dysregulation, so their cholesterol is off or their triglycerides are off. They have high blood pressure. And the extent of diseases that are impacted by poor metabolic health, as a physician, I don't know if I fully grasp the extent of, of what it impacts. And just to give you a bit of background, my exposure to metabolic health, like we didn't give it much thought as an IC physician that takes care of the sickest of the sick. My focus is on remedying people when they come in with their infections, when they came in with their COVID infections, as an example. The focus was on how do we get them through. And my journey to this was when we saw all those COVID patients coming through, which was tragic, and you never wanted to see somebody on a vent dying away from their loved ones. We saw a clear common thread that the patients I took care of often had either diabetes or prediabetes, had obesity, had metabolic syndrome. Okay. And in fact, to this day, I still haven't taken care of somebody that was completely healthy in the ICU from COVID. And so it was an aha moment for me when I realized, yes, there's a metabolic syndrome tied to this. What can we do about it? And realizing this is preventable. This is not only preventable, but reversible was a big aha moment for me. So I want to walk you through many of the disease states that are impacted or influenced by metabolic health. So as an example, risk of heart attack or stroke directly related to metabolic health. Some cancers, you're increasing your risk of malignancy or cancer by being metabolically unhealthy. Chris Palmer's work on mental health. Some people are calling it like a metabolic disease of the brain, and your inability to metabolize and having mitochondrial dysfunction in the brain and glucose dysregulation literally can be tied to many mental health disorders. We're seeing it come up in fertility, like in many patients that have PCOS or polycystic ovarian syndrome. That's a metabolic health disturbance. So if you improve your metabolic health, all these things that I'm mentioning can be improved. So your PCOS, your ability to produce offspring, literally by improving your metabolic health status. The Alzheimer's, dementia, they're calling this type 3 diabetes, direct link with poor metabolic health. And once again, if we improve one's metabolic health, you got to ask yourself, what are your true risks of many of these disease states? Kidney disease, also directly related. So all this to say, I want us to be more motivated to not only reverse metabolic syndrome, and when I'm talking about reversing it, obviously this is a personalized approach. We talk a lot about on our channel about how you eat, improving your protein intake, reduce your ultra processed foods, consider fasting if that works well for you, low carb, keto, many approaches that may be beneficial for folks. Talk about exercise, especially lift them weights, resistance training, keep moving. You move up those step count. Make sure you increase your step count, reduce your stress, improve your sleep, get that sense of community. All these things can help reverse metabolic syndrome. But I want to pay more attention to avoiding that next generation of landing in ICU and acquiring metabolic syndrome and all the things that we mentioned. Like, what can we do now to promote healthy living? And this is where I'm really feel passionately about our youth and telling them the importance of exercise and eating well, and showing them downstream what can be impacted if you don't take your health seriously. And and I don't think we're doing enough for our youth. They eat like crap, like the amount of ultra processed foods that we give our kids. In my opinion, many of them don't eat enough protein. We are on screens all day. There's social media and their mental health. Like, I think if we want to do the right thing for our youth and for society in general, we need to pivot. This needs to be a movement, folks. Like, as I said, currently, metabolic health is tied to all these disease states that are awful. And we can do something about it. That's the thing. We're empowered. We have agency here. And there's a lot of chips are stacked against us in many ways. Access to processed foods much easier than high quality foods. It's expensive. People's bottom lines are being impacted directly. Our economy is not thriving like it could be. So this is an uphill battle, but if we increase the awareness, we can increase that conversation and talk about creative ways of creating these wins for our youth and for others. Sky's the limit as far as I'm concerned. And I'll tell you this is what our channel is dedicated to. This is what the Quadcast, this is what Solvent Healthcare, this is why we started a nutrition brand. I want y'all to be your optimal self, like allow yourself to thrive, not just survive, but thrive and be that Guyana strong. You know what I'm saying? Because what I see on a daily basis, whether it is wearing my ICU hat or my palliative care hat, like acute care, you want to avoid it at all costs, man. Like, you really do. You want to avoid it at all costs. I mean, like, don't take this the wrong way. Obviously, you're coming in when you need it, but if you can make the changes today that could reduce your risk, it's a big deal. You know, I look back at even the last month in the ICU. We've had so many young patients. Many of them weren't preventable disease, but enough were from preventable disease, where you see them, you know, they're young families. They got kids that are never going to meet their father or their mother, and it's tragic. And I just feel like we could do more. We could do more to serve our public. We could do more to serve our patients. And if we put that emphasis on prevention, I really think it could go a long way. Prevention over prescription, dog. Here we go. All right, thanks for listening. Make sure to subscribe to the channel. Pass this along to anybody that you think is going to be helpful. Check out GuyanaNutrition.com, our latest endeavor. And we appreciate y'all listening. Peace.